Good afternoon, Angela. Thank you so much for joining us today
Thank you.
for this important conversation.
Thank you for having me.
Yes, I just want to get straight into the conversation. And today we're talking about mental health and coping during time of COVID. And so, I'm pretty sure that this whole pandemic caught everyone off guard when, we first
Right.
hearing things. We thought, okay, 2 months we stay in and then we'll, get back to normal. And so we see that this thing is not going anywhere for a while. Even
Yeah.
during this time, we've had, social unrest, so many different things going on. And so we know that there's so
Right.
many things going through people's minds and, just so let's start the conversation off by discussing just some of the feelings and reactions that people may be having during this time.
Yes. I mean, there are so many different reactions. COVID has really just been the main topic the last year. So people are feeling a number of things, just like you said. Initially, we thought this would be a short-term situation in which we were going to be homebound for a while. However, it has turned into a long-term situation. So there are many feelings associated with that. And what I'm seeing is a lot of stress. Stress about things that are directly COVID related, meaning, how do I prevent myself from getting COVID, to financial stress because many people have been laid off and are at home without jobs. So there's a tremendous amount of stress, and maybe even dealing with a loved one who has been diagnosed with COVID. So there's a lot of stress involved with this. I am seeing a lot of anxiety from people, anxiety about what will happen in the future. How long will this last? Is there anything I should be doing or could be doing? Also, along with that is a lot of depression that's starting to set in with being isolated from loved ones, being, homebound, being restricted to your home, quarantining. It's a lot of depression because there are no ways to engage and interact with other people in terms of their limited abilities if you're keeping yourself safe. So we see it's a lot of depression, meaning that people are, they're feeling sadness, they're feeling isolated about being quarantined, family and friends, not being able to see loved ones, being restricted in the places that you can go. So it's a lot of just being alone and being restricted. So you see a lot of depression.
Yes, I can definitely understand that because we've had so many different relatives. Both, my husband and I have lost relatives during the
Mhm.
pandemic. And of course, since we are social distancing, we weren't able to support our family members like we would have in the past. And so we've been trying to come up with creative ways to still support those
Yes.
and even support ourselves. And so that kind of leads me into my next question. So, what are some things that we can do during this time to cope and manage, during this pandemic?
I think it's a little bit, it's a that the best way to stay involved is also the education piece of it. So make sure that you're being educated and you're researching the facts about COVID, because the worst thing we can do is assume that we know. I think staying educated, but I also think that taking care of yourself personally, self care is so important during this time. And I know a lot of people think, what, I can't go anywhere, things are not open, but there's so many things that you can do. I first and foremost, I said just to breathe. breathe. I have to tell a lot of my clients that just stop and breathe, because we get so overwhelmed by the effects of COVID and watching the news and hearing about the different things that are going on in the world right now. So first and foremost, just breathe. Take a minute to take some breaths in the morning before getting out of bed. Take some time maybe to meditate. And even at night before you go to sleep, take some time to breathe, meditate, and unwind. During our day, our brains stay activated because we're busy, we're doing things, we're focused on other matters and situations. So it's a good idea to prepare your brain for rest. So when I say that, I mean, 30 minutes before going to bed, make sure that you're reading a book, you're, maybe getting some hot tea, sitting down without the phone, without the computer and the laptops, and just taking a minute to unwind so your brain has time to rest. No television, a magazine or a book. And just unwind before you go to bed so that your brain can unwind and just realize, oh, it's time for sleep now. It's time for rest. Because getting rest is going to be the most important thing as well, to take care of your body during this time. If you're not resting, it will manifest itself in other ways, such as stress, such as physical ailments. So make sure you're getting decent rest as well. Exercise has been one of the main things, in that when you're moving, and I don't mean, going to a gym, lifting heavy weights, if you could just take a 10-minute walk outside, or, maybe up and down your steps at home, that releases that feel-good hormone, so that it's been helpful to decrease the symptoms of depression. It makes you feel good. It gets your day started. So just make sure that you're, taking care of yourself. Make sure that you're taking breaks from the news. Limit the amount of news that you're watching. We have a tendency to keep the news on all day, just to hear late breaking news. And a lot of times it's just kind of a repeat of what you've heard. So it's really a good thing for your mental health to be able to structure that. So if you want to watch 10 or 20 minutes of news in the morning, and then another 10 or 20 minutes in the evening, fine. But, try not to inundate yourself with news. Make sure that, while I understand we're all in quarantine right now, and less likely to be meeting with others, make sure you stay engaged. Make sure you are communicating with others. So meaning, pick up the phone, make a phone call, talk to, loved ones, family, and friends for 10 minutes or so. The other thing is, I know we're all pretty much zoomed out, but, Zoom, FaceTime, take 5 or 10 minutes to check in on someone and to have that conversation, because not only will it help you, it will help them. So make sure you're staying connected to someone. Just make sure that you are being realistic about what's going on. Try not to assume. Our brains are so creative, and when we're stressed, we tend to worry about things that haven't happened yet. We worry about the future. I say stay present, stay very present and focused. And it's also about what you're saying to yourself. I'm very big on self-talk. So make sure that you are making sure that you are reassuring yourself, making sure that I'm being proactive, I'm using precautions to stay healthy. Make sure you have positive self-talk, because the negative put you in a space, an unhealthy space, because you begin to worry, you begin to become anxious about things that, are beyond your control. So healthy self-talk is a big thing. And of course, seek help. If you find that your anxiety, your depression, your stress is getting out of control, meaning that you've been feeling symptoms for several weeks now, or even several months, make sure that you reach out to therapists. There are psychiatrists, there are psychologists. Make sure you're connected, and make sure that you are maintaining structure during your day, staying busy, staying active. I think it's a good thing. I always tell clients, set your routine every day. Even if you're not working, even if you're in quarantine, get up, make your bed, Make sure you sit down and have breakfast. Have a routine that you look forward to every day. And then, I always say it's important. It's great when you have things that you have to do, but it's enjoyable. Create, try a hobby, try a new hobby, try something you've been meaning to get to, or you've been curious about. This is the time. This is absolutely the time. What I really like to say is sometimes we put a negative connotation to things. And while this has been a very trying time for everyone, I think it's important to recognize that, but also think of it as, instead of thinking about it as quarantining and being separated from your loved ones, think of this as a time of reset. This is a time that you have the opportunity and the time to, reassess goals. Think about things that you want to do, maybe connect and reestablish relationships. This is a really good time to do that because we have the time right now. So often we're running to work, running around and doing things. Reset. Take the time to stop and reset and use this time to your advantage.
So this is so good, Angela. So you said,
oh, I'm so glad.
You said two things that stuck out to me in the area of self-care. And so a lot of times we hear people they tell us, just breathe, just breathe. So is it any breathing techniques that you can recommend for us, on today, or any apps that we could use that could assist us with some breathing techniques? We know it sounds simple, just breathe, but what exactly are we?
So, just to start, the basic is just 3 deep breaths. I usually say, just take a moment to inhale, hold it for a second or two, and then exhale. Give yourself some time to just breathe. That's the simplest form I can give you. For those who anxiety, there's a grounding exercise that I use where I tell clients to take, if you feel like your anxiety is increasing, the signs, your heart rate goes up, your stomach may get queasy, you start to breathe rapidly. Take some time when you feel those symptoms coming on, stop what you're doing. Once again, take 3 deep breaths and then use your 5 senses to in an exercise. So I always, and you can go from 5, 4, 3, 2, 1, and you can do it in any order. So like 5 things you can see, 4 things you can smell, 3 things you can taste, 2 things you can touch, and 1 thing you can see. Just take the time to look around and do. Gives you a minute to stop and focus on something else so that you can calm yourself. And once you can do the exercise as many times as you want until you can calm down. And then that allows you to be able to think a little bit clearly. One of the biggest apps I love that I I recommend to patients is the Calm app, CALM. Very good app. Has relaxing sounds, relaxing sights. Just to get you started with your day. Take 5 or 10 minutes to listen to that app. Turn it on. Raindrops, the sound of waves on the beach. Those are things that can calm you. So absolutely, look on your app, download Calm. There are plenty of others as well, but take some time to download some apps that will help you relax and de-escalate.
Awesome. And then the second piece of that that you talked about was the healthy self-talk. And so just give me one example of
I think that a lot of times, especially during the times of COVID, what we feel like is we sit around and we think about, oh my, who have I been around today? I went to the grocery store. Did I touch something? Do I have COVID? I don't think I feel well. We go into this spiral. And I think, that's what I call stinking thinking, of course, but that's the negative talk. So instead, when you find yourself in the midst of that, try to stop it immediately and try to shift to a more healthier. I had to go to the grocery store today. I wore my mask. right? I use my hand sanitizer. I did social distance in the grocery store. And when I got back in the car, I did use hand sanitizer from my hands. So I am being proactive, and I'm doing everything recommended that I need to do to stay healthy and to stay protected during this time. So just think about the proactive things that you are doing to keep yourself healthy and safe.
Angela, that was a great example, because each time I have a doctor's appointment, when I go out, you cannot convince me when I get back home that I'm not sick every time. And so, so definitely I have to do the healthy self-talk for myself as well.
Yes.
To help us during this time, to cope and manage during COVID. So just let me know, like, how can we get help? Where do we go to get help? And also, when you finish that discussion, if you could please share your information, how can we contact you?
Certainly. The one thing I did not mention, and it's very big during this time, because it's specific to what we're going through, is I know a lot of individuals are experiencing grief right now due to loss of loved ones from COVID. So, and this is kind of the sign of the time that we're in for COVID. And so what I say is, allow yourself to grieve. Feel those feelings. Grief does not have a start or an end date. And unfortunately, it does not go in order. So, you will find yourself in denial. You will find yourself sad. Then you will find yourself angry. And the next day may be an okay day where you feel like I can manage this. But then the next day you go back to anger. It does not have a set order. So please allow yourself to feel those feelings. Reach out to other people, stay connected with other people during this time of grief, and understand that you will over time learn to manage, those feelings and manage the loss of that loved one. But you will constantly, have to be conscious of your feelings and your emotions regarding that. So I did want to put that out because I know a lot of people are dealing with that right now.
Yes, thank you so much. That's so important. Of course, during this time, and I think we've had that conversation that, you're not able to support your loved ones the way that you would have in the past with large gatherings. And so even that is bringing us grief, not being able to support our loved ones. But thank you so much for bringing that up. Great to hear you say that it doesn't have a time limit or on grieving.
No, it doesn't.
When people try to encourage you during your time of grief, a lot of times, you hear some of the strangest things, like it's time for you to move on, or you have to be.
Yes.
You all have to take the time that we need to grieve. Thank you so much for bringing that up during this time, because that is something that has been difficult for lots of folks to process during this time, the loss of loved ones, and how we've had to find new creative ways to support those around them.
Absolutely. Grieving is an emotion, and it's a process, and it's not a sign of weakness. So you don't have to be strong during your grieving period. Allow those emotions to happen. So getting help is, the next thing. If you find that your symptoms are increasing, that you need to connect and talk with someone, absolutely, therapy is a wonderful thing. I promote it all the time. I think the best way to start is, if you have insurance, start through your insurance to find out, what therapists are recommended for you, and on your insurance panel. That's probably the easiest way. If you call the insurance companies, they can send you a list. They can send you recommendations of therapists in your area. If you don't have insurance, never fear. There are avenues in which you can get mental health at a reduced price. One of those avenues is Open Path Collective. It is a website that you can go to. I think it's openpathcollective.org. And you can put in literally your zip code, and they will find it's a collective of therapists who are willing to provide mental health services at a reduced price. So even teletherapy. Open Path Collective website and read more about, how to join that collective so that you have access to tons of therapists who are willing to see you at a reduced price if you don't have insurance. And the other site that is very helpful when looking for a therapist is psychologytoday.com. You can put in your zip code once again, and it produces therapists in your area. You can read their bios, what they specialize in, look at pictures, everything is there at your fingertips. So don't hesitate. And even in your doctor's office, your primary care physician, sometimes you can ask your primary care physician if they have recommendations for a therapist, because they are connected to mental health providers as well. So there are plenty of opportunities to get help, to reach out to someone. My practice is TherapyWorks by Angela Hill, LLC. I'm doing you will find that most therapists are doing virtual sessions now, just to be respectful to the COVID process and what's happening during these times. So, be prepared, but I can be reached at 301-971-4086. Or feel free to look me up on Psychology Today. I am on Psychology Today, as well as Open Path Collective. Just be mindful that, like I said, due to social distancing, a lot of therapists are doing virtual sessions. Please be patient with us, as we are, most of my therapist colleagues that I've spoken with, the numbers have increased. People are reaching out for help, thankfully, reaching out for help. So we find ourselves very, very busy. So please be patient. If you call or reach out to a therapist, it may take just a little while to get the response back. But however, we always get back to you because we recognize that you need some help. But if it is an emergency, don't hesitate to call, local emergency number, or go to the emergency room if you feel like this is a situation in which I cannot wait.
Thank you so much, Angela. And I don't know if you feel this way, but do you think that because there is a stigma associated with, seeing a therapist, and so especially in our community, and so do you think that during this time of the pandemic, it has allowed individuals to, because it's virtual, I don't have to walk into an office space. And so do you think that is why the numbers have increased during this time?
Yes, I think it has been a wonderful opportunity. If anything positive has come out of this, it has been a wonderful opportunity for therapy. A lot of people were hesitant about it, didn't know, just didn't have a lot of information about it. So now I think it has opened people up to understand you don't have to travel, you don't have to deal with traffic, and you have the added privacy of being in your home. I think people are experiencing stress and things like anxiety and depression more than they ever have prepared for. So I think that people are recognizing that when they need help, and they're recognizing the signs and symptoms, and they're reaching out.
I had someone to tell me recently that they actually started therapy during the pandemic, and it was the best thing that they ever could have done in their life. A safe place to freely talk about all those things. And, the person told me they had suppressed so many things from childhood that,
Yes.
and they felt so light and free during this time. And so anyone watching today, I would encourage you to, take that time to make that phone call or check out those websites that Angela provided. We all go through different things, and sometimes our family members and friends may not exactly understand, but this would be a space that you can share those feelings with someone and tell you what you need to do to move on from whatever you're feeling. And so with the therapist, be a safe place to just kind of, let go and, work through those feelings that you've been having for a better quality of life.
Yeah, I definitely want to share. For those of you who find yourself in a crisis situation and maybe you're hesitant to reach out, or find your situation to be dire. I did want to leave the number to the National Suicide Prevention Line, which is 1-800-273-TALK, TALK.
Well, Angela, I thank you so much for taking time out of your busy schedule to have this conversation with us today, this very important conversation. And I think you've given us enough tips and tools to cope and manage during this time of COVID. So I thank you so much for joining us today.
Oh, it's my pleasure. Thank you for having me. I always enjoy this.
Thank you.
Okay, thank you.
It was such a much needed conversation that had so many thought-provoking parts to it. And I think that a lot of people do need some tips, honestly, because I think before COVID, not many people were really thinking too much about how to combat these problems that they haven't really faced before, with the new social isolation due to having to socially distance and not seeing each other as often. So I do think that that was a much needed conversation. And now we are moving on to our Q&A portion. So if anyone has any questions, you can put it in the chat. I see that someone asked if we could post Miss Angela's information again. Yes, we will be able to give you that information. And the first thing that we are going to do for our Q&A session is introduce our guest for today. We have Ms. Jacquesline Walker, and she is a clinical psychotherapist in the Washington, D.C. area. She's originally from Boston, Massachusetts, and received her advanced degree from Howard University. She's a founder and CEO of The Well Firm, a teaching and consulting agency that focuses on mental wellness in the law profession, as well as demanding high stress industries, as well as other demanding high stress industries, sorry. As a licensed independent clinical social worker and certified clinical trauma professional and certified clinical stress management consultant, she has a diverse background in social work, crisis management, and motivational interviewing that allows her to fully connect with clients of various backgrounds. She also maintains a private practice that focuses on providing clinical mental health services to Black women working in high stress environments, as well as those experiencing racial trauma. So we have a very, very amazing guest today for our Q&A session. So I have 2 questions so far. Please, you can direct message any questions you may have to me, or you can put them in the chat. So our first question for you, Jacqueline, is do you think that the mental health challenges that have kind of been brought to light throughout this time of COVID were possibly there before, and it's that we were too busy to sit down and really sit with our thoughts or our feelings? Or do you think that it was more so a cause and effect that COVID caused these new found mental health challenges?
Thanks so much for having me, Tara. I'm really excited to join this conversation. So I think, especially for older populations, COVID sort of created new challenges, right? And as Angela spoke about in the video, we see a lot of grief, we see a lot of loss, but not just physical grief, right? Not just people passing away, but the grief and loss of not being able to connect with people like we used to, right? Not being able to see some of our dreams fulfilled for this year and last year, whether it was weddings or family reunions or seeing loved ones. A lot of us have younger family members, or a lot of us have older family members, which we can't connect with because of fear of putting them at risk for COVID, among other diseases. And so it definitely created new challenges as in terms of the racial trauma that we've seen in the media, and other things that have happened with the political divisiveness and everything like that. That has been present, right? That has been apparent for generations. It's just now that the rest of the world is sitting and watching and seeing what people of color have dealt with on a regular basis. But as it relates to older populations, I think we're definitely experiencing brand new challenges, and it's exacerbating some of the depression, some of the loneliness, some of the isolation that older populations already experience, just not being able to, go out as often or not be accessible to people or different events. But the COVID has definitely put a strain on a lot of relationships and a lot of things that people have wanted to do this year.
Thank you. That was a great answer. And something that stuck out to me was one, when you were talking about kind of this constant kind of feeling of limbo within the grieving process of opportunities that we had hoped for to come, or relationships with people, or being able to see our family members, or experiencing loss of loved ones. I think that is a very big point that a lot of people have been feeling, and it's nice to put kind of a term to it as well, because I think that there is power within having a term to describe how you're feeling or what you're experiencing. So thank you for that. And another thing that you mentioned about senior populations, and it kind of made me think about how a lot of seniors before COVID, relied on the different holidays or different events that they could go to get that kind of social stimulation and that feeling of community. So to have that lessened and stripped away almost it has been a very big topic of concern, and how to get those senior populations back into their kind of groove of being able to communicate and socialize with one another. So I think that was very timely.
And imagine the dilemma with some of these populations, right? And with some of our loved ones, it's, I care about you so much and I want you to survive. So I'm going to stay away from you and continue to make you feel this isolation, right? How, like, trying to grasp that in your head is so like, you love me, so you're going to stay away from me. You want me to be safe, so you're going to leave me isolated, right? That's so stressful, and it takes a toll definitely on everyone's emotional well-being when we think about it.
Yes, thank you. And we have another question about practicing self-care and positive self-talk. It can be hard sometimes for us to be kind to ourselves, especially when we've had so much time, almost a year, of just constantly sitting with ourselves and our thoughts and feelings. So I guess that constant reflection, that state that we're in, has made it difficult to practice that positive self-talk, especially when you're seeing all of the things that are possibly going wrong, or only seeing, the negative. So I guess I'm just asking, what are some other strategies that we could use? Because, sometimes journaling might work for one person, but another person is like, no, that doesn't really work for me. So do you have some other strategies or tips?
For positive self-talk or wellness in general?
For positive self-talk, for self-care, well, just anything, because I think that just anything in general would definitely help.
Mhm. Absolutely. So when it comes to positive self-talk, I think we all do better, right? And there's no quick fix for it. It just takes a lot of practice, and it takes you being present in the moment, right? When that happens. So you are, I think we've all been guilty of it one way or the other. We're doing something really quickly. I think I was cooking yesterday and I put too much salt in the rice. And I was like, oh, I'm such an idiot, right? And right there, I'm like, okay, Jacqueline, get it together. You're not an idiot. Mistakes happen, right? How can you move forward? How can you correct it, right? And so I think thinking about it in that way, being conscious of how you're speaking to yourself, how you're being kind to yourself, how genuine you're being to yourself, right? That's important. Sometimes the kindest people that we know, sometimes the most genuine and generous people that we know, actually have a lot of internal conflict when it comes to speaking life into themselves, right? And pouring out the good energy. And I try to think about it in this way. I can only be good to others as good as I am to myself, right? So how good can I be to myself so that I can pour that goodness elsewhere? Um, I laughed when you said journaling, because as much as I'm a therapist and I consult and I do all these things, I hate journaling. It bothers me so much. I don't want to sit down and write, right? That's the last thing I want to do. But that works for people, right? Sometimes if you are tech savvy, I say put all your thoughts in an audio recording on your phone, right? So maybe send yourself a little voice memo or a voice note. If you are creative, try to put your feelings or your thoughts or your stresses or anything that you're feeling, maybe draw, maybe paint, maybe um, do something with your hands that's going to take your mind off of what's going on inside, right? A lot of us, Angela was wonderful when she talks about anxiety and how that shows up. Anxiety is a very physical emotion, right? Which sounds really strange, but when you think about it, anxiety and stress manifest in our bodies, whether they show up as headaches or backaches or tension. You notice that there are very physical bodily responses to stress and anxiety. But anxiety, when you think about it, it's rooted in that spiral thinking. It's not grounded in any fact. It's grounded in what is the worst that can happen, right? That's what our anxiety does. And so sometimes it's good to take a second, right? Angela talked about breathing. You want to make sure that when you're breathing, you're not using your chest, because your chest can be very shallow. You want to use your belly. You want to take deep belly, make sure that your belly is expanding as you breathe in and contracting when you breathe out. Putting air inside your belly, having those deep belly breaths is going to calm your heart rate. It's going to relax your muscles. It's going to ease that tension. Additionally, with some self-care strategies, you want to make sure that you're getting outside in some way, shape, or form, whether that's opening a window and having some fresh air get in, or you're able to take a walk with a pet or a loved one or a neighbor. Physical activity, as much as you are able to do physical activity, it's the one thing that can activate and stimulate all the happiness hormones that we have in our body. So that is the only thing that you can do that will give you a positive response or positive feeling of hugging a loved one, or of watching a comedy show, or of being able to sit with someone and have a genuine conversation. So definitely try to get outside, definitely try to get some fresh air. Those are the main coping strategies I try to use, because it can be a lot, right? I think this year has been a lot for everyone, not just mentally, but definitely emotionally. And so if you can do something for yourself that has a little less brain power and a lot more physical activity, I think that definitely can help with your well-being and with genuinely just keeping yourself calm.
Thank you. I think that was very well said, but also I like the fact that you mentioned that journaling, not for everyone. But there are so many things that you can personally tailor to your self-care. What makes you feel good? What makes you feel loved by yourself? And I think that that's very important, especially during this time. We have another question. Can you provide some suggestions for families to stay connected in order to reduce social isolation during this time?
Something that is very old school, right? But it's something that can bring a little bit of joy, especially for our older population, older family members. I lost my grandmother this past December. She was 99. She lived a wonderful life, but I wasn't able to see her. And so something that I started doing was writing her letters and sending them through the mail, right? She couldn't necessarily operate Zoom, so that was a little difficult. And FaceTime, if my aunt wasn't around, I wasn't able to FaceTime her. So I tried to think of old school ways that could still keep that connection, right? Could still create some sort of anticipatory feeling, still get some excitement. And it also kept her active, and it kept me engaged too. I mean, we don't write letters anymore. We send text messages or shoot emails. So it was also something different that I enjoyed. And so I tried to send a card or do something to stay connected. But I think it's important to be creative, right, with our older populations and with loved ones. Everybody is across the country, right? And sometimes in different countries. And so it's important to make sure that you are staying connected however you can. For some of us who are in, my generation or younger, we tend to, just pick up the phone and FaceTime. But, personally, I'm getting tired of Zoom. If I have to stare at a screen for the rest of the day, for more days, I may, lose my mind. But trying to find different ways to connect with people and creative ways to connect with people is just as important as well.
Thank you so much. And I love the fact that you brought up that feeling of, I've seen it called Zoom fatigue, of just feeling just tired of being tired about Zoom and constantly seeing people through the screen and just having to mute and unmute. It's just a lot that goes into it that can make people feel just tired before they even get onto Zoom. So I have another question. It's a twofold question.
Okay.
What are some things you would suggest for single mothers with young children during this time? And then also for people who are in domestic violence relationships and creating boundaries or space in their home in which they can create those moments of self-care and peace that they need.
So those are two separate questions, and they're so tricky, right? Because they involve very different boundaries. So the first one, if you're a single mom with young children, you are probably sick of your children, and that's okay, right? It happens. I was stuck with my partner in COVID, and I can't tell you how many times I've wanted to, throw something at him, but doing my best to stay sane and create those boundaries. With young children, if you are a single mom with young children, depending how young your children are, so I don't know particularly the age of the person who asked the question, but I will say it's never too early to start teaching your children boundaries, right? Things like sharing, things like respecting others' toys or privacy, or being patient, or making sure that they are cleaning up and putting things away. Those are all things that they would learn if they were at preschool, if they were at elementary school, right, or middle school. And so it's important to still try to employ some of those behaviors to to the children, excuse me, and making sure that they're knowing, okay, hey, like this is mom's time. And so when you notice that I have my headphones on, right, that means you can only disrupt me when, if you're hurt or somebody's dying, right? Obviously not in those words, but making sure that your children understand what patience is, right? What sharing is, what boundaries are. Those discussions are important because they're going to take them with them when they get older, right? And it's also going to help them start to establish healthy boundaries as well, right? With their friends and with their loved ones as they get older. And so I would encourage you to definitely figure out what you need, prioritize that as a parent, whether it's I need some privacy. So maybe reach out to a neighbor or a friend or a loved one who also has another small child that can team up and support you in babysitting, right? Or you can do that for someone else. I know people have started to create small bubbles or communities of friends and loved ones during this time because either they couldn't see extended family or they realized their family was pretty small and it was just them. So lean on your support system, try to figure out how to best utilize or create that quiet space for yourself. If you notice that the only time you get is when your child goes to sleep, right? Try to see if you can adjust your work schedule. If your boss will allow you to work a little later in the day or start your day earlier so you can actually utilize that time that your child is sleeping to keep to yourself. But try to be creative and try to be flexible. As it relates to domestic violence situations, when it comes to boundaries, when it comes to being safe at home, this is one of the most stressful and probably most unsafe pandemics that has hit society when it comes to domestic violence, because people are stuck at home with their abusers. And so it has been extremely stressful. And I know that doctors and helping professionals like myself and other therapists have started to be creative in terms of how to support people who have been in domestic violence situations. So I would do your best. If you are in a DV situation and you do want to get out, I would make a doctor's appointment, right? I would schedule a telehealth appointment or make an appointment where you have to go in the office and then have that conversation with your doctor. They are a medical professional. They do have confidentiality. I think with telehealth, it has become a little difficult because if I'm there and I'm asking you to tell me about how you feel, but you're sitting at home, you can't necessarily express that because if your home isn't big or you live in an apartment, then you have the worry and fear of your abuser hearing you. And so I would do your best to try to make a doctor's appointment and then have those conversations with your doctor or with a loved one that you trust to try to figure out what your next steps can be to safely remove yourself from that situation.
Thank you so much. That's very creative. I see a lot of people in the chat saying that you're mentioning of writing a letter, but also I like how you were saying with setting boundaries with children, and that they would be learning this in school. So it's still right on time to teach them that. And also I appreciate you taking the time to, talk about a way that someone within a domestic violence relationship could seek help in a way that would benefit them, especially with so much telehealth, like you were mentioning, or having to do things at home in which the problem lies. So thank you so much, and I will turn it over to Ms. Bellamy.
I would just like to say thank you so much, Jacqueline, for coming on. And at the last minute for us, she actually replaced another therapist for us on today that had an emergency. So we do appreciate you coming on to respond to the questions. But one thing we didn't ask you, if you can share how we can get in contact with you if we need to reach out to you, for assistance.
Yeah, absolutely. I will put my email in the chat box. There was another website that wasn't mentioned in Angela's conversation with you, and that site is Therapy for Black Girls. It's actually a wonderful site for, it has a list of Black women and Black men professionals, therapists that serve all populations. And so even though the website is Therapy for Black Girls, there is a host of Black and Brown therapy professionals on there who serve all types of populations and can be a great support to anyone looking to start their therapy journey. And so that is another site which can be really helpful. So I think it's important also to make sure that you have a good fit for a therapist. Not everyone is going to vibe. As wonderful as I think I am, I know some clients, I'm not their cup of tea, and that's okay, right? Your therapist has to be what works for you. And so you may, spend some time trying to find the right fit. But once you do, it's going to be truly a blessing because you have an unbiased, non-judgmental person that you can vent to and brainstorm solutions to concerns or issues or unresolved trauma that you have.
A lot of times I feel like you go to just say your regular physician, and if you're not getting the answers that you need to get, and then you just get frustrated and say, I just don't like going to the doctor. And so that's not the answer. We can shop around and find the right fit for us. And that's very important. Thank you all for joining, and have a good rest of the day.